Have you ever been in a hospital, maybe lying in bed and feeling like just a passenger, really hoping everything goes okay?
Yeah, it's a common feeling.
We often think, patient safety is totally up to the doctors, the nurses.
Right. Their responsibility.
But what if you were actually a key part of that safety net, maybe one we overlook?
It's a really profound shift that's happening, isn't it? Healthcare worldwide is moving sort of slowly but surely from just providing care for the patient to genuinely working with the patient. And your active participation, it's not just, a nice to have. Right. It's actually critical. It enhances safety, boosts communication, cuts down on errors, and honestly, it just leads to better results for you.
That's exactly what we're diving deep into today. We're looking at this groundbreaking new tool. It's designed to measure exactly that, how involved you are in your own safety.
Yeah.
Think of this whole deep dive as maybe a shortcut to understanding how you can be a real partner in your care.
And what's really interesting here is that even with all the talk about patient engagement,
Yeah, we hear that term a lot.
we do. But until very recently, there just wasn't a standard, scientifically solid way to measure your specific safety behaviors during a hospital stay.
Not just general health stuff.
Exactly. Not just general health or like motivation. We're talking concrete actions you can take.
Yeah.
Checking your meds, thinking about fall prevention, making sure people are washing their hands around you.
Okay.
There wasn't really a tool for that. And that was a pretty big gap in understanding what was actually happening.
So it sounds like a real vulnerability was identified there, and researchers stepped in.
They did. They came up with this innovative solution.
Yeah.
The Patient Participation and Patient Safety Practices Scale.
They have a mouthful.
Yeah. Let's maybe call it the Patient Safety Participation Score for our chat. It was developed by Meltem Dursun, Engin, and Seren and İntepeler.
Okay.
And it's basically a 32-item list that gives you a score, reflecting how actively involved you are.
So how does it work? What does it measure specifically?
Well, its structure is actually quite insightful. It breaks down participation into 4 key areas.
4 parts. Got it.
Yeah. So first, there's a general section that covers your overall awareness if you feel it's partly your responsibility.
Okay. General mindset.
Exactly. Then there's infection that's really focused on things like hand hygiene. Are you paying attention, maybe reminding others?
Crucial stuff.
Absolutely. Then you've got falls. It's about being proactive, things you can do to prevent falling while you're an inpatient.
Right, like keeping things clear around the bed.
Precisely. And finally, drugs. This bit emphasizes your communication, your vigilance, basically making sure everything is right with your medications.
Makes sense.
And the scoring is simple. It ranges from 32 to 96. Higher score means more participation.
Okay, this is fascinating. But how do you even create a scale for something like this? It feels a bit abstract, like measuring participation. It wasn't just thrown together. Right?
Oh, not at all. Absolutely not. This scale went through a really, really rigorous validation process. Think of it like putting a new car through every single safety test imaginable.
Okay, intensive testing.
Definitely. They ran a detailed study, involved 424 inpatients in a Turkish public hospital. This was over several months, between June 2021 and February 2022.
So quite a decent sample size. And what did all that testing actually show? Did it hold up?
It really did. First off, they had a panel of, I think, 7 experts review every single item.
Okay.
And the experts overwhelmingly agree they reached a high consensus, what's called a content validity index of 0.90, basically saying, yes, this scale measures what it claims to measure.
So the experts were on board. What else?
Then they used some pretty advanced statistics, things called exploratory and confirmatory factor analysis. Fancy terms. But they basically confirmed that the scale's 4-part structure was solid.
So the general infection, falls, drugs categories made sense statistically?
Exactly. They showed a good model fit, meaning the data supported that 4-factor structure.
Yeah.
And maybe the most important part, reliability.
Meaning it's consistent.
Precisely.
Yeah.
Like a good measuring tape, right?
Yeah.
You want to give you the same result each time you measure the same thing.
Yeah, otherwise it's useless.
Right. And this scale showed excellent overall reliability, a Cronbach's alpha of 0.922, which is very high. Even the subscales, like falls and drugs, which were a bit lower, were still statistically acceptable. It's a trustworthy tool.
Okay, wow. So it's got the scientific backing. What does this actually mean for you, the listener, maybe on your next hospital stay? How can this tool actually change things on the ground?
Well, the real potential here is about shifting the culture of healthcare. This patient safety participation score isn't just an academic exercise.
Right.
Nurses can use it. patient safety officers, quality improvement teams. They could use it to pinpoint where patient participation might be, well, lagging.
So identify weak spots.
Exactly. And that insight isn't just data for a report. It can actually guide targeted actions like developing specific patient education materials or maybe staff training to help them encourage patient involvement. It helps build that culture of shared responsibility.
So it really empowers you, the patient. It sounds like it fits perfectly with those big global initiatives like the Joint Commission's Speak Up campaign.
Absolutely. That's the goal.
Mm-hmm.
Speak Up encourages you to ask questions, to be active.
Mm-hmm.
And understanding a tool like this, even just knowing it exists, helps you become a more informed, more active member of your own healthcare team. You move from just receiving care.
To co-creating safety.
Exactly. You become an active co-creator of your own safety.
That's a powerful shift.
It is. Ultimately, this patient safety participation score gives us a valid, reliable way to understand and, importantly, promote your direct involvement in keeping you safe during care. It's a blueprint for active partnership.
So let's leave you with this thought. Imagine a future where your level of participation in safety, your score, if you will, is something that's routinely assessed, maybe even discussed with you and your care team. How might knowing your own score change your approach next time you need healthcare? What new possibilities could that open up for really empowering patients right there within the hospital walls?